Trauma is a team sport. That culture and commitment to a collaborative environment is key to the success of the trauma center. You cannot do things alone.
Tufts Medical Center has both an adult level 1 and a pediatric level 1 trauma center. Trauma and critical care is the epicenter of the need for collaboration in medical and surgical care. The whole horsepower of the organization is required and oftentimes marshaled to the bedside when an acutely injured patient comes in.
Here at Tufts, a full trauma is our highest level of activation. As soon as the alert comes out, we send out a page which alerts all of the different specialties within the hospital.
The blood bank, the orthopedic department, the neurosurgical department, the radiology department, the pharmacy, nursing, surgeons of all disciplines. That first hour from the time of injury to the time of medical treatment is really the opportunity to intervene, reverse the course, and save a life.
We do the complete evaluation very, very quickly, and we make critical decisions based on those 2 or 3 minutes.
The real role of the trauma surgeon is not just to provide surgical treatment to those patients, but decide who to pull on, who to call, who goes first, who goes second, who goes third. Are we going to get a CAT scan first, or do we need to go to the operating room so neurosurgery can do their job?
First, we go looking for life-threatening injuries. After that, we go looking for injuries that can cause serious disability. The rest may be serious, but it's not life-threatening. Those are the priorities in that order.
One of the things that differentiates Tufts Medical Center is communication. Tufts tends to attract not just physicians and healthcare providers, nurses that are talented in what they do, but that also come with a pretty significant degree of compassion and empathy. That is just as important for patient care as the skill that we bring to an operating table.
Research is a requirement for a designation as a level 1 trauma center. The main reason is to improve patient care. You can treat a finite number of patients, but you can potentially help many more with the result of your research. We can diminish pain and suffering, eliminate unnecessary procedures, develop new protocols to treat patients with certain conditions.
The importance of a level 1 trauma center really can't be underscored enough. It's not just about clinical excellence and taking care of critically ill patients. It's also a commitment to extend into the community and do outreach and really try to make the population safer as a whole.
Tufts is definitely a big part of this community. We take roles in education, violence prevention programs, trauma research.
Our faculty have been involved in the Stop the Bleed campaign to educate the public in the instance of an active shooter or shark attacks on the beach about ways of dealing with life-threatening hemorrhage at the site of care where these injuries occur to be able to save lives.
I have the luxury of practicing in a superb trauma center. The reason we are able to achieve the things that we achieve here is because we have an incredible support system built all around us. The sky is the limit.